Okay, hi everybody and welcome to this introductory course to chronic oedema and lymphedema. This is the first time we've tried this, so we just bear with us. Kenji is in the background to help with anything technical. Just type anything in the bottom if you've got any difficulties or any questions throughout. As I said, it will last 20 minutes approximately, and any questions that come in will, if we don't pick them up in the session, they'll be addressed as soon as possible after that. And a number of people will be listening to the recording of this later. So I'm going to start. You should never really start with an apology, but I'm got a bit of a cold, so forgive me if I look as if I'm crying. I'm not. I'm just got streaming eyes and nose, and I'll try not to cough into the microphone. But it's great to have so much interest in this course, and hopefully there'll be a chance to kind of be in touch with people throughout the week. So I'm here live, but also within the team and involved this week will be my two colleagues, Yolanda Borthwick, who leads the Forth Valley lymphedema service, and Rhiann Noble-Jones, who's also working clinically in Edinburgh at the moment, and both of them are teachers in the university on lymphedema. And then later in the week on Friday, we have our guest lecturer, Dr. Vaughan Keeley, who's a consultant in palliative medicine in Derby, but heavily involved in lymphedema, including the International Lymphedema Framework. And there'll be an opportunity to pose some questions to him prior to that session. So apologies that they couldn't be live here today, but they will be communicating with you over the week. So this session partly to introduce the team and just the general topic. And although lymphedema is relatively readily identified, chronic oedema, there's a lot of overlap and relationship to lymphedema, and yet chronic oedema is so common, very debilitating both physically and emotionally for patients. And there can be the same complications arising due to pressure ulcers because the tissues don't get the same nutrition. It's a threat to tissue viability, and some recent work has suggested that it's the biggest risk factor for pressure ulcers. So I think it needs to be taken more seriously. But yet the risk can be greatly minimised if patients are given appropriate information and are treated promptly, which, sad to say, isn't often the case, or often it's too late. And I'm sure if you've worked in community, at least you'll have seen plenty of patients which have problems that could have been much less had they been picked up earlier on. So over this week, we'll be discussing some of the causes of chronic lower limb swelling and the role of the lymphatic system and its relationship to lymphedema. We'll be looking at the risks associated with it, particularly if it's not treated or not treated well or promptly, and also the strategies to reduce that swelling and the complications and help patients to do the same. And undoubtedly that would bring them a lot more comfort and ease, more independence and ability to self-care. So in chronic oedema, which is defined as such after 3 months of swelling, over time it will damage the lymphatic system and there will be a superimposed lymphatic insufficiency or lymphedema. So the two are very closely related. So part of it will be helping to think about whether someone with swollen legs has superimposed lymphedema, and we are concentrating on lower limbs this week. The course, if you've registered, you will see that it's delivered on Moodle, and this is what you'll see in the first page. This is the university's virtual learning environment, and it shows the programme for the week, which will be revealed day to day to you. So today there will be a case study revealed and some questions to work through. And over tomorrow, then on Wednesday, there will be another presentation with some specific questions, which we're asking that everybody gets 100% correct. It's not terribly complicated, but hopefully that will stimulate some discussion, and there will be an opportunity to make comments online or ask advice or from other people who maybe have different experiences from you, because I think there's probably a range of people online. Some have quite a considerable experience with lymphedema or chronic edema, and some maybe see these patients as part of their normal role. So on Thursday, just to go through that, we'll ask you to submit any questions that will be posed to Dr. Keeley on the live webinar, and if not, addressed within the session again shortly after it. There will be an assessment and course evaluation after that, but fairly simple, and on completion of that, the certificates will be issued, plus the opportunity to have a discount for anybody who is relevant who wants to join the course. So it is open till the 28th of February, so if you are unable to do it all this week, you'll get plenty of time to do it, and just get your course evaluation assessment in prior to that date, so that you can we can follow you up, and if you want to take it forward, you can have the certificate and the discount to the first course, which goes into this obviously in a lot more detail and is much more clinically focused. So I haven't really got anything else to add. There are two resources, web resources, that have been flagged up for today. One is an NHS site, and one is a site that's been developed by lymphedema practitioners in Scotland, specifically to try and answer questions for different professionals and also give some patient information. So you might want a wee look round about that, and it covers a lot of what we'll be talking about this week. But if there are any questions now, happy to take them. I haven't seen anything coming through so far, but if anybody wants to ask anything, just type into the box at the bottom. There's something coming through. Oh, lots of people typing. The course is we have two courses that run together that form what they call the key worker course in lymphedema. It's a small amount of attendance. The first course is a week's attendance, and there'll be online work and work-based activities between August and January. And then the second part of the course is more work-based and online, covering application of skills in different patient groups, and that goes from February to May next year. But there's no attendance to the second course and 5 days attendance to the first course. I didn't actually introduce myself at the beginning, so apologies for that. I'm Margaret Sneddon, and lead the lymphedema education and research here. I do have a small clinical commitment at Forth Valley Lymphedema Service, but have been involved in education for more years than I care to remember, but do still see a small number of patients. The distractor's not a lymphedema term. I think Kenji, somebody must have seen an earlier version of the case study. That was just a note to me to put in some wrong answers in the case study. The two courses lead to, if you do all the assignments, it leads to a graduate certificate in lymphedema management, and they run, that's 60 credits, and it runs at about 580 to 90 per 20 credits. Kenji, can you help with the Angela? Just answering Ailey's question. It's research that's been done in Japan by Professor Sugama. She presented it at the International Lymphedema Conference here in June. It's not yet published as far as I'm aware, but there will be an abstract for it on the ILF website, which is I'm going to get www.lympho.org, and you should be able to get the conference abstracts. If not, let me know and we'll try and find out, and if there's a journal or which journal it's going to be published in. Thanks, Kenji, that was quick. Have I missed anything? Okay, are there any other questions? This course is simply a taster and hopefully some discussion with participants, but and hopefully not too onerous, about 5 or 6 hours work over the week. It seems to take longer when there's several people typing. Just to answer Jenny's question, hopefully some of this is applicable immediately. Anything that's new to you, there's not anything that you couldn't apply, or if there is, there'd be suggestions as to where to seek advice. But it depends what you mean by putting into practice.
Sorry, I'm just going to interrupt to say Elaine had a question earlier on. She asks, I'm on leave from work on the last day, 30th January. Will I be able to catch up next week?
The answer is yes. That's not a problem. I think something came through from Kenji, but if there's no other particular questions, we are here to help. Do send us queries. So 28th of February is the deadline. Plenty of time. So if there's no other questions, we'll just sign off now and look forward. There's a couple more coming in, but look forward to hearing from you over the course of the week. Okay, and thank you all for taking the time to join us today.